If people in your family have early heart attack and stroke, we need to know about that. That impacts your risk. Most people have no idea what a vascular surgeon does until something goes catastrophically wrong. Now, spoiler alert, if you care about your heart, your brain, your kidneys, your legs, even your sex life, yeah, this video is for you. I am Dr. Lily Johnston. I am a vascular surgeon and a prevention obsessed cardiometabolic physician. My mission is to put myself out of business as a surgeon by catching vascular disease early enough that you never need someone like me in the operating room. So let's talk about what a vascular surgeon does, because I feel like most of the patients I see, and even some of the doctors that I talk to, don't really understand what I do. Some people think I just deal with feet, like I'm a podiatrist, or that I'm a cardiologist and just deal with the heart. Other people think vascular just means like varicose veins or blood clots in the legs. So I want to spend a few minutes today unpacking what I do when I am wearing my surgeon hat, and then explain to you why that matters and why I have become so passionate about prevention. So we have 60,000 miles of blood vessels in our body, right? Half of them bring the blood from the heart with the oxygen and all the nutrients out to the tissues. And the other half bring it back. So the arteries, that's the first half that bring that oxygenated blood out. The veins bring the blood back to the heart. Now, the cardiologists, the heart doctors, they take care of the blood vessels that really impact the heart directly, like the coronary arteries. Then there's the neurosurgeons who will deal with arteries that are inside the skull. But everything else, I guesstimate that about the 59,000 miles of blood vessels, everything else in the body belongs to me. So this is the highway system that brings this essential oxygen and everything else to the tissue. So that's your brain, it's your kidneys, your legs, your arms, all of your organs other than the heart and the brain. So if you have a circulation problem anywhere else, that becomes my problem. And so let's talk about it, because I think it's really important. Not everybody thinks that what we're talking about is varicose veins or a circulation problem, but a lot of people have concerns about dementia. A lot of people have concerns about kidney failure. Somebody in the family went on dialysis and they saw how devastating that could be. Whatever your concern is, there is a really good chance that your vascular health is a big part of that. So I want to talk about that today, because I think, people sometimes keep tabs on their blood pressure. Occasionally people are monitoring their cholesterol, but it's just incomplete, because we are looking at the whole picture and the whole person. And we are not just a heart, we are not just a kidney or a liver. We want to focus on the whole human. And part of my concern is, when I, as a surgeon, treat vascular disease, surgery is really late in the disease, right? By the time you need surgery, vessels are 80% blocked, maybe completely blocked, but it took years most times to get to that 80% blockage. What if we tackled the risk factors for vascular disease when there was just the beginning of plaque, when it wasn't even 50% narrowed yet? Raise your hand if you think that's a good idea, because I do. And the surgery that I offer, it's limb saving, it's life saving sometimes, but it comes with a whole host of complications. Time in the hospital, and sometimes the intensive care unit, infections, repeat surgery, blood thinners, like all of this stuff. And sometimes patients sort of limp along, no pun intended, for a while after surgery, and they never quite get back to their old selves. And I just saw this over and over again, and was so frustrated that we missed an opportunity a decade earlier, 2 decades earlier, to intervene for patients when it might have made a world of difference in their life. Because this is a preventable, reversible disease when we catch it early enough. And that is really what I want everybody to understand. So whether your concern is avoiding stroke or heart attack, whether it is just being vibrant into your later years, vascular health matters to you. And I want to talk about how we can get this disease process under control before you ever need surgery. So, common risk factors are the common ones, right? Most people are aware of them, but high blood pressure that's untreated. The older we are, the higher the risk, again, because this builds over years and years. But diabetes, insulin resistance, metabolic syndrome, these are important risk factors that sometimes go undetected. There are very specific things like inflammatory disease, rheumatoid arthritis, lupus that can increase the inflammation in the body and cause injury to the blood vessels. And that injury is what starts that formation of plaque. Women have a certain subset of risk factors that often don't ever go recognized. So if you had gestational diabetes or problems with your blood sugar in pregnancy, gestational hypertension, problems with your blood pressure in pregnancy, and early miscarriage, early delivery, all of these are risk factors for women's heart disease. Did you know that hot flashes are actually a predictor of adverse cardiac events in women? So if you have severe hot flashes when you go through menopause, guess what? We need to talk. We have some work to do in making sure that your blood vessels are as healthy as we can make them. So there are a large number of red flags that we can detect earlier on in life that go well beyond your cholesterol and that blood pressure, although those are relevant. And we talk about that more in some other videos. Before I carry on, I just want to stop because if this is important to you, what I want is for you to hit like or subscribe so that we can keep producing this content for more people so that we can get the word out there and help educate as many people as possible about the role of prevention in this disease and all of the body that is affected by the blood vessels. So please like and subscribe. It really helps get this message out to the people who need to hear it the most. I appreciate you. Let's keep going. If you think you have vascular disease, what should you do? Well, I think you should go to your doctor. You should get your labs. We talked about that in a previous video. We'll link that in the description below. And I want you to know what your risk is. Okay, so that is a combination of your physical exam, your blood pressure, your lab tests, your family history. So if people in your family have early heart attack and stroke, we need to know about that. That impacts your risk. Do you have some genetic predisposition? I don't know, but we better figure it out. So we have to ask some good questions, take that history, and understand your risk. Now, if you have cramping when you walk in the legs, an ankle brachial index is the screening tool that most vascular surgeons will use to help understand the blood flow in the legs. And that's just a ratio of the pressure of the blood getting down to your ankles over the blood pressure in your arms. Okay. It's not the most sensitive tool. And when I talk to patients about early prevention, I prefer other tools like carotid intimomedial thickness, which is an ultrasound test in the neck, or coronary calcium scores, CAC, sometimes even coronary angiography or a specialized CT scan with dye looking at the blood vessels in the heart. We are going to talk about that in depth in another video, so please stay tuned for that. And I'm really looking forward to it because I'm really passionate about getting early imaging for patients to understand their risks. And then once you have risks, we think about all of the levers that we have to reduce your risks because we know that there are multiple things we can do that are in our control that can reduce our risk of cardiovascular disease. So let's just talk about 5 of them really briefly right now. And if you want to know more about any of these, I want you to leave a comment below and tell me what you want to hear more about. Because right now, this is a small channel and you guys are directing where we go next. And I really need to hear from you. What is the most important thing for you to learn about so that I can create the content that matters most for you? So the first thing is eat for your goals. Because some of you are expecting me to tell you which diet you should eat or which nutrient you have to have. And the truth of it is you are a whole patient. You are not just your blood vessels. So certain people don't tolerate dairy very well. Some people do very well on a certain nutritional plan for other reasons, like it reduces their inflammation or it improves their depression. There are lots of reasons why people choose certain nutritional approaches. I feel very strongly that if you have type 2 diabetes, that we really need to use nutrition as the biggest lever we have to help control your blood glucose, and your insulin. So, nutrition is a huge lever in that, and it will also impact your lipids, your triglycerides, and your HDL cholesterol. So, nutrition is a huge lever for that, especially if you have type 2 diabetes. For people who don't have type 2 diabetes but have primarily lipid concerns like LDL cholesterol, we know that a Mediterranean based approach can be very helpful. You can do both. You can have a low glycemic Mediterranean diet. And so, really, you just need to know what are you trying to achieve with your nutrition. And then we can have an informed conversation about which direction we're going to go. And there may be some consequences to what we choose, right? I have many patients on a very low carbohydrate diet or a carnivore diet because it serves their goals. That's okay. Most of them have reduction in their adverse lipids, but some people don't. And then we just talk about what do you want to do about that? Most of those patients prefer not to be on medications. As long as it's an informed decision, that's okay. This is your body. You get to choose. I am obligated to talk to you about risks. And if you have plaque in your arteries, there's risk involved. But guess what? Not my choice. It's yours. My job is to teach and inform and educate and bring you the best information that I have. You get to assimilate all of that. And people make different choices, right? Some people decide that they want to reduce risk no matter what. And whatever tools are available, they will take that. Other people say, I feel amazing and my priority is not to be on medications. And if I keel over 5 years earlier from a heart attack, so be it. I don't want to be on meds. Okay, right? It's not my job to make you live forever in a way you hate. It is my job to give you information and access to tools, and you decide how you want to live your life. Okay, so we're going to eat for our goals. We are not going to subscribe to nutritional dogma or religion that says there is only one approach or there is only one way to eat. That drives me bananas. So let's eat for our goals and understand that there might be some consequences to that and take that in stride. Okay. Next thing we're going to do is we are going to move like our life depends on it because it does. So for my patients with peripheral arterial disease or PAD, walking is transformative. It is the mainstay of treatment when we just have claudication or pain with walking, and it helps build that collateral circulation, meaning it helps build small blood vessels that go around the areas that are narrowed or blocked with plaque. So movement is enormously helpful even for my patients with metabolic disease. Muscle is one of the biggest sinks for glucose in the body, the biggest utilizers of glucose in the body. But to make it work, you got to make the muscle active. So going for walks after dinner, doing air squats after a big meal, like that opens up the floodgates for glucose to fall into those muscles. And then our blood glucose level doesn't rise as sharply with our meals. So we move like our life depends on it. And that doesn't have to be an hour in the gym every day. That can be taking the stairs and parking far away and doing a few air squats every hour when you're seated at your desk at work, right? This does not have to be painful, sweaty, Suzanne Summers like exercise. This can be what you need it to be, but movement is medicine. All right. The third thing we are going to do is use medication as a tool, not a verdict, right? So most of my patients on the surgical side have plaque. That is how they came to me as the surgeon. And guidelines recommend that we use medication in those patients because, especially in that group, it reduces risk of heart attack, stroke, and limb loss. This is a big deal. But it doesn't mean it's a life sentence, and it doesn't mean lifestyle has failed or that it isn't worth it to do these other things like optimizing our diet and moving like it's medicine, okay? All of those things are hugely impactful and make medicine work better. So there are a lot of people who come to me as well that are doing everything right. Their nutrition is dialed in. They are exercising, they're incorporating resistance and cardio and stretching and yoga. They're doing everything right. Their sleep is okay, their stress is okay, and they still have plaque and they still have elevated risk factors. And they are crestfallen when I recommend an experiment with medication, right? A trial of medication to see if they notice any adverse effects. They think that it means they have done something wrong and they have failed doing all of this hard work to optimize their lifestyle. And it's just not true. Okay. They have done an amazing job dialing everything in with their lifestyle. And it means that we don't need much medication. Maybe we don't need any, right? Again, it's always their choice. It's always your choice. But I offer medication as a tool to further reduce risk for people who are open to it. And I always say it's a trial, it's an experiment. If you feel terrible on it, I don't want that for you. My whole goal is to get you feeling well and vibrant in your life. And if the medicine impedes that, we'll stop it. Okay. We also have other choices, other things we can do. Everything is just a trial. So you're not wedded to this. It's not a death sentence. Medications are a tool, and they are one of many tools that we have. So I don't ever want people to feel like this makes you a failure. There's a lot of sort of gaslighting in the medical wellness sphere that says you should be able to do all of this with just your diet and your exercise. And if you can't do it, then you're doing the diet wrong, right? If you don't fix everything with carnivore or everything with veganism, you're doing it wrong. And a lot of people sort of hang their head in shame and they quietly leave those communities. And we never hear the stories of the people that it didn't work for because they go to something else, right? We never hear the stories of the people that shout from the rooftops, this did not work for me. I am not better. You do sometimes, right? There's occasionally somebody who's loud. Paul Saladino was somebody who was very uh, openly carnivore. He wrote a book about the carnivore diet and has ultimately switched to what he calls an animal-based approach, where he's incorporating, more carbohydrates because that's how he feels better. And I think that's super brave. And he got a lot of flack in social media and in the space for, betraying carnivore. And he didn't do it right, and this, that, and the thing. And people have 100 ways if you only had done this or shouldn't done this instead. Anyway, long story short, if you require medication to manage your risk or manage the disease that has happened to you, it is not a failure. You are not broken. It is okay. A lot of us get dealt a genetic hand that is not within our control. And I am here to tell you, if you need some medication to get you where you need to be so that you are able to live your life optimally and you can go dance at your daughter's wedding, or you can take your son to college and walk up all the stairs and help move him into the dorm room, like whatever it is that moves you, it is my job to help you get there, and we can use whatever tools you're open to. So medication is a tool. It is not a verdict. It is not a life sentence, and it does not make you a failure. All right. We need to treat our health like it's a retirement account. This is item number 4 on this list. So everybody knows from the day they start working, because your employer tells you that you need to be putting money away in your retirement account for the future, right? Someday you won't want to work 9 to 5 anymore and you will need an income to live off of. Well, I see a lot of patients who spent a lot of time in their careers building their financial retirement account, and they are now able to go fishing and they are now able to go travel. Except, how do I know that they're not doing those things? Because they're in a hospital bed, because they needed an operation from me, because they spent all of their health capital grinding to earn money to put in their retirement account, and they neglected their health. And they felt young and vital enough at the time. They didn't have a diagnosis at the time, and they thought, I'll rest when I retire. I'll sleep when I retire. I will be fine. It'll work out. So it's heartbreaking for me to see these patients who have this plan for their retirement, these ideas about what they were going to do, how they were going to spend this time, and they can't do it. Their bodies are breaking down and they are spending a lot of time in doctor's offices and in hospitals and recovering from whatever ailment is plaguing them, and they are not outliving that life. So what I want to say is that we need to build our health retirement account just like we build our financial retirement account. The decisions we make every day in our 20s and 30s and 40s and 50s, it compounds just like interest, okay? And so it is not okay anymore to say, I'm young, I feel fine, I'm going to neglect my health. It is going to catch up with you. So that's not to say that you need to be perfect. It's not to say you got to get everything dialed in right now, but it is to say the decisions we make every day compound. And so you can be making good decisions and building your health equity so that you have a vibrant body to continue to carry you through your golden years, or you can be making choices that are ultimately going to catch up with you. And what I want is for people to be able to do what they are driven to do, be the light in the world for as long as they can and enjoy the whole of their lives. So please start today. Invest in that health retirement account just like you're putting money away for your financial retirement. And the last of our items on this list talks about that, okay? And it says start wherever you are. It is never too late to put a little money away in that health retirement account, okay? Even if you're quote unquote retired, we can still make good choices today that will benefit us tomorrow. I have seen remarkable improvements at every age. So, at 45, you're building that reserve, but at 55, you can still reverse damage. And at 65, the change is enough to keep you off my table if we start when symptoms are mild. So, the body wants to heal. The body wants to be alive and vibrant and taking you through this big, beautiful world. So, give it the conditions that will allow it to do so. This is not about a longevity practice. This is not about making you live as long as humanly possible or just counting the birthdays. This is about preserving the quality of your life so that you can think clearly, so that you can walk independently, dance, travel, play with your grandkids, and stay out of the hospital, to stay independent as long as possible. And that is all served by healthy blood vessels. Because again, those blood vessels take that oxygen, that nutrition everywhere in your body. And if you have circulation problems, you're going to have organ problems. And that is what starts us down this road. So you don't need perfection. You just need awareness and education and a plan. And wherever you are, you can start today. You can get 1% better. I know you can do this, and we are here to help. So please share this with someone who needs to hear it. Share it with someone you love who has some health struggles, who's feeling, you know, depressed and despondent and discouraged by their experience. Remind them that there is hope. There is always something in our power to do 1% better today versus yesterday. And it matters. It really does. So please protect this body, treat this body like it belongs to someone you love. Thank you, Hannah Corbin. And we will talk more. I will help you along this journey. It's been a pleasure chatting with you today, Dr. Lily Johnston. We'll talk again soon.